Welcome to the Zenix Hospital in-service tutorial video series. This series provides detailed information about the Zenix Monitor Defibrillator and its functionality. These videos serve as an adjunct to formal training. Please take time to read the operator's guide available online at zoll.com. Obtain formal training from an appropriate authority before using Zenix for patient care. In this video, we review manual defibrillation and testing with external paddles using the Zenix Monitor Defibrillator. Begin by ensuring the external paddles are connected to the multifunction cable. The external paddles are designed for both adult and pediatric patients. To expose the pediatric plate, press the black PD button at the top of the paddle, then slide the adult plate upward. To increase or decrease the selected energy, use the Energy Select button on the sternum paddle or the Energy Select key in the action bar of the Zenix Monitor Defibrillator. Once the desired energy level is selected, use a gel medium between the patient and the paddle. Apply the paddles firmly to the anterior wall of the chest. Place the sternum paddle to the right of the patient's sternum just below the clavicle, and place the apex paddle on the chest wall just below and to the left of the patient's left nipple along the anterior axillary line. Press the charge button on the apex handle or on Zenix. When you reach the desired energy level, the charge indicator on the apex paddle illuminates. Once charged, prepare to deliver the shock by applying a force of 10 to 12 kilograms or 22 to 26 pounds to each paddle to minimize patient impedance and achieve optimal results. Simultaneously press and hold the orange shock buttons on each paddle with your thumbs until the energy is delivered to the patient. To cancel the defibrillation at any time, either select the Disarm key on the touchscreen or push the Energy Select key on the paddle. To conduct an energy delivery test with external paddles, verify that the paddles are securely inserted into the paddle mount. Disconnect the auxiliary power by removing the power cord. Ensure that the multifunction cable is connected to the external paddles. Verify that the 30-joule self-test key appears. Select the 30-joule self-test key. Verify that Zenix charges, a constant tone sounds, and the shock LED on the apex paddle illuminates. Press the Disarm key to disarm the device. Verify that Zenix disarms. The tone will stop, and the apex paddle shock LED is no longer illuminated. Select the 30-joule self-test key. Verify that Zenix charges, a constant tone sounds, and the shock LED on the apex paddle illuminates. Press the orange shock buttons on both paddles simultaneously. Verify that Zenix discharges and the 30-joule self-test passed message displays. We have now reviewed the process of manual defibrillation and testing with external paddles using the Zenix Monitor Defibrillator.